Hey guys, welcome to Unleash podcast brought to you by Hidden Gene, where we talk about how to unleash your hidden potential. I'm your host, Yuri Diorgis, and we have a great episode for you today featuring Dr. Michael Mesh. Dr. Michael, thank you for being on today.
Thanks for having me, Yuri. Appreciate it.
It's a pleasure to have you. Before we jump into today's topics, we would like to invite you to subscribe to this podcast on YouTube, Apple Podcasts, or Spotify. You can also find these podcasts at Hidden Gene website, hiddengene.net. And if you live in the area and you have not been at Hidden Gene, make sure to visit hiddengene.net, grab a free trial pass, and come do a workout with us. All right, so let's start some great conversation today with Dr. Michael Mesh. Doctor, let's talk about first this barbell rehab course. What is this about?
I created the Barbell Rehab Method Certification basically because I realized that there was a big gap between the rehab and the fitness industry, right? So I spent the first 4 years of my career working directly one-on-one with patients. And I realized that as physical therapists, we can get these patients really, really good. Like we can help them decrease pain, improve performance, but a lot of them end up falling in love with exercising when they're with us. And I loved sending them to personal trainers after they were done with physical therapy. But talking to other physical therapists, they're hesitant to do this in fear that maybe the personal trainer or the strength coach really doesn't understand how to work with people who are in pain or who have had pain. So I realized that there was a gap there. And then on the flip side of things, personal trainers are kind of hesitant to send people to physical therapy because the physical therapist may not even have ever lifted a weight in his or her life.
True.
So my goal with the Barbell Rehab Method certification was let's get all of these folks in the same room. Let's get personal trainers, strength coaches, and physical therapists in the same room, and let's get everybody on the same page for how do we work with people that have different types of aches and pains. So that's really what drove me to create this certification
So,
course.
so the certification is for both audience or for physical therapists that want to work with strength coaching, or is for all of them?
It's for all of them. So what we do is you come to the course, you attend both days, and then we do an online exam after. And once you pass the exam, you can use the BRM credential, Barbell Rehab Method. And what it does is it allows you when they go in to create their profile on our site, because we're building out a big directory as like a one-stop shop where potential clients can go to it to search for coaches and clinicians. And the cool thing about this cert is that when you go onto the site, the people that take the course can then list themselves as either a coach or a clinician. So that helps to sort of clear up any kind of confusion, because now we have a place where clients can come, they can filter it by coach or clinician, right? And coaches can come to see a list of clinicians that they may need to refer out to, and clinicians can come to the site to see a list of coaches. So it is a one-stop shop certification for both coaches and clinicians.
There is any pre-requirement? For example, do you have to have any prior certification before you do that? Because for the physical therapist, I think it's easier. I mean, as long as you are a physical therapist, right? You kind of qualify. But personal trainer, you go through just like years of experience, or do you have to have some sort of accreditation before that?
Gotcha. So ideally, I mean, you're exactly right with the whole physical therapist thing, right? You're either a physical therapist or you're not.
Right,
You went to
right.
PT school or you're not.
Mm-hmm.
So for the personal trainer side of things, we would prefer that the personal trainer would have some sort of baseline certification, whether it's NASM,
Mm-hmm.
ISSA, NSCA, ACE. We would prefer that. But that being said, we're not going to turn you away if you're somebody that has had 10, 15 years of training clients under your belt without one of these NSCA and NASM certifications. So basically, as long as you're a personal trainer, and you are marketing yourself as a personal trainer and you're actively working with people, then we do welcome you to the course.
And is it 2 days course or 1 day?
2 days. Yeah, we used to teach this as a 1 day course. As like we used to call this the Barbell Rehab Workshop, where it was a 1 day course, and we taught squat, bench, deadlift, overhead press all in 1 day, and realized very quickly that hey, we can really expand on this. So we have now turned that into a 2 day certification course, and we taught the first one in April of this year. I've now taught maybe 12 or 13, and we have 8 or 9 more scheduled for the rest of the year. So we are full speed ahead with this thing right now.
It's only in-person type of training, or do you have an online version?
Right now, it's only in person. So we really like getting out there, visiting some of these gyms like Hidden Gym, which I haven't been to yet, but I've seen pictures and I am super excited to have the opportunity to teach there. So right now, the certification itself is only 2 days live. We may move to online in the future, but I really I think people are ready. And from what I've seen this year, people are pretty thankful to get out and get some live
Oh yeah, absolutely.
hands-on teaching again.
I,
Yeah.
I'm thinking more about people that live in different countries, because you can really expand worldwide when you go online.
Oh yeah. So we have 3 online courses right now that are not certification courses, but they're continuing education, CEU approved courses. And I mean, those online courses have been taken by people in over 100 countries so far. So yeah, I do get people, when are you bringing the barbell rehab method to Europe? When are you bringing it to Indonesia? And I'd like to, when the world completely opens up, I'd love to start heading to some of these other countries. And yeah, we'll see where this really goes as far as how to get this to people outside of the United States as well.
So on the in-person experience, will students will have the opportunity to like perform things, or is more you guys demonstrating things?
Yes, that's an interesting question because from the ones I've taught, it seems like there's 2 types of people that come to this course, and I blatantly say this at the course because regardless of why you're coming, I want you to get what you're paying for, and I want you to get the experience that you're coming for. So, a lot of people come because they really want to work on refining their coaching skills,
Mm.
right? So, when we go into the breakout and the demonstration portions, I am really upfront with saying, hey, if you came here to really like expand and improve your coaching skills, make sure you're the ones in these demonstration sessions providing the coaching cues. So we always, parts of the course, we break up into small groups. So then the folks that really want to work on their coaching cues, that's when they get the chance. And then there's always going to be some that actually want their own technique looked at too. So
Right, right, right.
I always tell those people, because I mean, personal trainers and strength coaches also lift, right?
Hmm.
So this is also a great opportunity for them for like instructors like myself to give them feedback and to also receive feedback from others in the course as well.
So do you still doing the same breakdown of bench press, deadlift, squat, or now that it's 2 days, you expanded to something else?
So we took the 1 day course and we added about half a day of material to it. And we also expanded on the topics of squat, bench, deadlift, and overhead press. So the way that it's really broken down is day 1 is upper body. So we are starting the day off with our principles of rehab and training, like an hour-and-a-half long lecture where we lay down the foundation of, if you have a client that comes into the gym with knee pain during squats, what exactly do you do and in what order? And then the rest of the morning, we take care of the bench press. And then in the afternoon, we're hitting overhead press, but we're also covering some of the horizontal and vertical pulling patterns. How do you modify a pull up for somebody with elbow pain? How do you modify a row for somebody with shoulder pain? So that's day 1. This 2 day certification course is more of a comprehensive, how do we really write programs for clients that have pain? And then day 2, we hit lower body. The entire morning is going to be the squat. And I'm always super excited to teach that because the entire morning is all about the squat because there's so much going on with it, right?
Yeah,
We
yeah.
are hitting we are hitting like big topics like back pain during squats, hip pain during squats, knee pain, ankle mobility limitations. And then in the afternoon, we hit deadlift and the lunge. And both days we end with Q&A and case studies.
And the online exam is based on that content.
Exactly. Yeah. So 20 questions, multiple choice. And we felt strongly about making some sort of exam because if we're going to essentially create a certification course, I want to know that if we are listing somebody on our site, whether you're a coach who passed the certification course or whether you're a clinician, and I always say it like this: I don't expect you to treat exactly like I would. I don't expect you to write programs exactly what like I would. But if a potential client reaches out to you based on through our site because you're certified in the barbell rehab method, one thing what we would expect from you is that you're going to find a way to help this client continue to work out, right?
Hmm.
We're trying to filter through the BS because there are so many, and we're physical therapists, chiropractors. It spans across all disciplines. There are unfortunately people still out there saying, hey, deadlifts are bad for your back, squats are bad for your knees. So now, super proud to have a list of people that hopefully won't be telling their clients things like this.
Yeah. Do you also cover, since the name of the course is rehab, do you also cover some other techniques not directly related to lift for rehab, like KT tape or other things that can help you during the rehab, or is pure lift?
Gotcha. Yeah. So we don't cover anything like hands-on manual therapy, K-tape, or anything like that. It's not necessarily that we don't find them beneficial or anything. Obviously, things like those have a time and place. It's just when we sought out to create a course for both fitness and rehab professionals, we decided that it was in our best interest and everybody's best interest if we're going to get this thing approved for continuing education for strength coaches and personal trainers to really make it more of a hands-off kind of seminar. So we note some of those things that you mentioned, like K-tape, manual therapy, stretching, foam
Hmm.
rolling, what have you. We talk about them, but we don't really dig too deeply in them. We're digging more into the framework of what kind of modifications can we make to these lifts for people that have pain, whether it's to the lift itself or whether it's to the programming.
Correct me if I'm wrong, but I just by the description that you said about the course, it seems like a very interesting course, even if I'm not treating athletes with pain. I mean, just for me to gain this knowledge, and you're probably gonna also teach proper form in some of those exercises. I will probably gain a lot of knowledge that I can use on my daily activities with my clients, regardless if they have pain or not. Right? Do you believe so?
Yeah. Absolutely. So that's a question we get from because we have people of all level of experiences attend this course. And that's something that I really love is the diversity in the room. Like when we taught at Kabuki Strength in Portland, a couple of the physical therapists there have never lifted a barbell in their life. And I was super excited about that because they're taking the steps necessary in their because they want to improve their clinical practice, right?
Hmm.
And obviously, we also had coaches in the room that have been coaching the squat for 20 plus years. So I always say, yes, we teach the basics of how do you coach these lifts, even if there's no pain whatsoever. And then once we're done coaching the nuances of the lift, then we say, all right, now that you know how to coach a bench press for somebody without pain, what kind of things can we do to it if somebody says, hey, I have shoulder pain, hey, I have elbow pain? So yep, we cover it both aspects, pain or no pain.
For the personal trainer, it's kind of a no-brainer to learn this because he can apply at the gym when he has a client that express some sort of pain. But for the PT, since the PT is usually practicing in a location that many times does not even have barbell, how is he going to apply those concepts on his facility? Because as a PT, you probably know that most of the physical therapy facilities they don't have barbell, right?
Yeah. So, first off, that's something we're trying to change and something that we are seeing a nice trend in the physical therapy industry where we are starting to see more free weights in the clinic. Okay. So whether even when I was in the clinic, and I tell people this up front, my first 4 years of practice, I worked a lot with, I was fortunate enough to be in a facility where there was barbells and dumbbells.
That's rare.
And
That's rare.
yeah, yeah, and it is. And I'm fortunate that in my small little circle of physical therapists that we do all have this stuff, but I realize that in the larger industry as a whole, we do need to get better with that. But I had the I was lucky to have that, and I can't tell you how many people over the age of 70 and 80 where I wasn't necessarily getting them into like an uncomfortable low bar back squat position, but we were progressively loading them, right?
Hmm.
We were doing goblet squats, sit to stands, trap bar deadlifts.
Wow.
So
Wow.
um, the majority of physical therapists that do come to our seminars have access to barbells and dumbbells in their clinic. And for the ones that don't, um, I end up having a conversation with them where they're like, I am going back to my clinic manager and I'm saying we need to get a squat rack in our clinic.
Wow,
So
that's
we're
great.
we're trying to change it.
Yeah, and I say that because recently I had a Linz Frank injury. Not recent, like 1 year ago, I had a Linz Frank injury on my foot, and
Hmm.
I had like three months of rehab in a clinic nearby my house, and it's really just physical therapist kind of style, basic exercise. I didn't see any barbell at all. I maybe saw one kettlebell, but not really barbell or free weight. So that's why I asked this question because it's still very traditional physical therapist methods, you know.
Yeah, yeah, and I think you're going to see that that's going to continue to change with a lot of young and upcoming physical therapists in their late 20s, early 30s. We are trying to make a big push here to, hey, people aren't as broken and weak as we think they are, and one of the best ways to get more resilient and strong for your daily activities is to start loading things up, even in the presence of injury or pain. So I think things are heading in the right direction.
Now, do you see this as a progressive type of treatment? For example, I get there. I will always, of course, start a very low volume. And in which moment of the physical therapy you evaluate and you say, okay, now let's try to introduce barbell training, like 4 weeks out, 8 weeks out, is because it feels like it's way more advanced, right? So it's not something that you introduce right in the beginning.
Yeah, correct. And it's all going to be based on the injury and whether it is truly like an injury or if it's in the presence of like chronic pain. So let's take an example of an actual like tissue injury where somebody had some sort of, I don't know, muscle strain, broken bone, like fracture, something where somebody was post surgery is another good example
Yep,
where
yep.
somebody had a surgery. Obviously, we are still abiding by surgeons' recommendations, and if we see something like no weight bearing on the feet for 6 weeks, right? Then we're not going to blatantly just be like, all right, it's time to do a barbell back
Right.
squat on day one. But in the absence of any kind of physician contraindications, we can start loading rather early. Like take an example of I don't know, 15 kilogram like barbell, like a 33-pound barbell with a 10-pound bumper plate on each side. A lot of people, even early on in the rehab process, can deadlift 53 pounds, whether it's off of the ground or whether it's in a rack pull. So it's not necessarily, and I think that's where, oh man, I could go down a whole rabbit hole of getting scripts of physicians being like, no squats, no
Yeah,
deadlifts, right?
yeah.
What does that mean? Like forever? Is it forever? Is it for 4 weeks? But I think this idea is that when somebody says, oh, barbell exercises, we're already thinking of, oh man, it's a power lifter with 600 pounds on their back. But
Hmm.
a 33-pound barbell rack pull from knee height is something that can be implemented very early on, like very early on, as long as there's no contraindications of, hey, we need to wait a couple weeks due to healing. So,
No, it makes a lot of sense. Yeah, because I remember it took me probably 8 weeks to start doing deadlifts again.
mhm.
Because my injury was on the foot, so I was working more on my mobility, stabilization, And even I felt safer to do it only in 8 weeks. I was not feeling very stable to do before that. So there is also that matter, right? How the patient is feeling at that point.
Oh, yeah. And we always have to take that into account because the patient, I mean, maybe they've never lifted before, right? And now they have an injury, so they don't trust the injury itself,
Right,
right?
right.
They can, if so, that I always tell people to zone out and look at the bigger picture, right? If a patient is uncomfortable starting something early, then we wait, right? Because the big thing with barbell rehab is I want to encourage people lifting into their 80s. I want to see people lift their entire life. And if that means taking a couple weeks, like starting at 12 weeks instead of 8 weeks, then that's what we do. So it's always about meeting the patient or the client where they're at the time of evaluation.
When did you start the certification? More than a year, 2 years ago, or how many years?
So the certification itself, I taught the first one this year, April 10th. So we are only what,
Oh, it's very new.
yeah. So I'm 5 months in. I taught the 1 day course that I mentioned. Remember how this used to be a 1 day
Yeah.
course? I taught that about 12 times. I started that in September of 19. So I myself personally have been teaching 2 years. The 1 day course, we taught it end of 19 and a little bit into 2020. And then obviously live courses sort of tailed off mid 2020, right? So that's when we sort of pivoted to some online learning. And then at the end of last year in September of 2020, I was like, you know what? It's time to take things to the next level. I think people are going to be ready for some live learning in 2021. And it was September of 2020 that I made the decision we're going to teach our first certification course in State College, Pennsylvania in April of 2021. And we've been just pushing forward ever since. I taught every single weekend in August. We're now building out a team of instructors. So right now we have 3 instructors in training, and we're looking to make this something let's try and get this message to as many personal trainers, strength coaches, and physical therapists as possible that, hey, just because you have a little bit of shoulder pain, knee pain, there's ways to keep you in the gym.
Uh, did you feel that you have more support and embrace of this program from the personal training fitness community, or more from the physical therapist community? And I ask this because I know there is a lot of not ego, but a lot of tradition involved in physical therapists, like the methodology. So there is a lot of
Mhm.
resistance sometimes for a change in methodology. So which audience embraced this more naturally?
So 50-50, to be honest.
Wow,
And
really?
I
Wow.
say that because the physical therapists that do come to this course are already progressive, right?
Hmm.
So we're not actually the people that are stuck in the old methodologies aren't really even coming to this course. I want them to, right? Because I mean, we're not saying that the old way of doing it is like completely wrong. Like, how dare you treat that way, right?
Hmm.
We're just trying to, and I always tell people, look, if you are somebody that is treating based on an old, outdated methodology, and you do come to this course, I'm not asking you to completely make a 180 and change the way you treat. But if you can take, and with any Con Ed course, if you can take 1 to 2, I like to call them golden nuggets or key points that you can integrate into the way you're coaching, into the way you're treating, then I would consider that a good course. And there. You're right with the whole ego thing, and there's
So you so
physical
you, so you
therapists.
probably received some criticism as well, right? From the most traditional ones.
Oh yeah, so I still get from the traditional physical therapists like, how dare you teach personal trainers about rehab? And they're missing the point, right?
Hmm.
We're not teaching personal trainers how to do manual therapy. We're not teaching personal trainers how to do physical therapy assessments. But, and here's where we draw the line, because we are really hitting one of those elephant in the room gray areas in fitness and rehab, and it's, can personal trainers work with people in pain? And it is, in my opinion, a resounding yes. And we always say this: if pain can be eradicated with a simple form adjustment or a programming adjustment, then that's something that a personal trainer can do,
Yeah.
right? If you, let's say, take somebody with hip pain during squats, and all it takes is an adjustment in the stance. Maybe we move the stance in or out. Maybe we turn the toes out more or less. If that's all it takes to immediately make a squat pain free,
Why
a
not?
personal
Yeah,
trainer,
why not?
yeah, exactly. So if personal trainers can do this, and then I always say, hey, look, if you've tried to make form adjustments, if you've tried to make programming adjustments, and the pain's still lingering, refer out, right?
Mm.
So I'd like to think that that's a pretty rational approach, because how many people do you work with that have had zero pain ever, have had no surgeries,
Yeah.
have no mobility limitations, right?
Yeah.
We're human. We
Right.
have aches and pains. So
Yeah.
that's my little spiel.
No, no. It's. I think it's important to cover that as well because there's a lot of protectionism from the old school approach to treat patients. Many physical therapists, they will only release a patient when they are pain free, and in the meantime, you go into those sessions while you could be doing something more aggressive a little bit, right? You could be doing something
Yeah.
more to push more.
Yeah.
So I think that what you're doing is bridging the gap, and that's fantastic, I believe.
Yep, that's appreciate that. That's what we're really trying to do. And that's like we always say, hey, if somebody has a bum shoulder and they're in rehab for shoulder pain, there's no reason they still can't be safety bar squatting in the gym heavy, right? So just because you have one body part that maybe isn't cooperating right now, we're teaching personal trainers and strength coaches, okay, let the physical therapist work on this shoulder right now. This person's currently in rehab. But here's what else we can do, right? You can still train legs intelligently. We don't want somebody detraining over the span of 6 to 8 months with a shoulder injury. We don't want somebody's legs detraining, right? 6 to 8 months with a shoulder injury. So
Do you also agree, because this is something that I heard a lot, when you have one limb, let's say one side of your body, like the left shoulder that is recovering and you cannot lift, do you believe that training the other one kind of help the injury one to recover because of the blood flow, things like that, or it really doesn't interfere at all?
From what I've read, we do see some crossover. It may not be as robust as we thought, but there is some, maybe 10 to 15%. Don't quote me on that. But we do see some transfer from one limb to the other. So I mean, I'm still recommending it. Hey, if you're in a sling in your right shoulder, why can't we do one arm dumbbell bench presses, right? With
Yeah.
the non-affected arm. If you're same thing we see with, hey, if you're in a brace, maybe you're post ACL repair and you're in a brace on the right knee, we can still do single leg RDLs on the left side. We can still do leg extensions and leg curls on that left side. So training as much as we can in the presence of injury. Yes, we're going to see some transfer. So let's take it for all it's worth.
For the people that got your certification, you probably have a lot of certified profession at this point. Do you have any like good case study that someone that is already using those practices and having good results?
Oh yeah. So one really that really sticks out to me is that somebody, so let's talk about shoulder pain during the bench press. There is this conventional wisdom that would say, hey, if you're having shoulder pain during the bench press, you should move the grip in, right? Narrow grip benches are, the idea is that narrow grip bench press is inherently safer for the shoulder joint than wide grip. But if we go by that, which there is no real evidence to really substantiate that, that can really pigeonhole us. So one that comes to mind is I had a student who had a client with shoulder pain during the bench press, and the shoulder pain was occurring with a narrow grip. And he didn't think that he was quote unquote allowed to like widen this grip for this client because he's heard in the past, oh, wide grip is bad for the shoulders. But what we teach is that some people who have a lot of pain with a narrow grip bench press are actually quite pain free with wider grip. So something as simple as giving this personal trainer essentially permission to try out a wider grip bench press for his client with shoulder pain. I got an Instagram DM like 2 days after, like, oh my gosh, I can't believe that like I've been forcing this guy into a narrow grip bench press, and as soon as I gave him permission to widen the grip out, like 100% pain free.
Wow.
So we see things like that all the time. As far we squat stance, just allowing people to squat certain ways, different ways, because I mean there's still some. And I don't need to name drop anybody. There's still people in the industry that are saying we need to force people into toes forward squats. And it's just, in my opinion, not something that we believe in because everybody's built differently. So just giving people permission to, hey, it's okay to turn your feet out. It's okay to squat wider, and just giving the personal trainers all of these options to work with their clients.
Is the same myth of many people that's still preaching that the only squat that is valid is as to the grass. But some people don't have that mobility. So now what? I don't squat at all?
Exactly. Or like some sort of, do you mean no muscles whatsoever until like you go ass to grass? Of course, we're still getting muscle activation, even if the squat's a little bit high. So I'd rather, and we talk about mobility, I'd rather do both, right? So if somebody wants to squat deep, but they can't, we're going to load that squat to what is comfortable for them right now, but we're also going to simultaneously work on mobility at the same time. We're not going to say, oh, sorry, you can't squat. Here's mobility drills. Do these for 8 months, and then we're going to squat, right? No, it's a both. It's not an either and or. It's meet them where they're at right now, train within the range of motion and the comfort they have, and then tease in mobility drills at the same time to work on what they don't have.
And again, this is a myth because I've seen many studies that say that even 90 degrees squat, still a lot of activations going on there. You really don't need to go as to grass to be a valid squat.
No, exactly. And 5 years ago, I would have told you yes. I would have said, hey, if that hip crease doesn't come below the top of the patella, then it's not a squat and it doesn't count.
So what changed then? You learned more?
Yeah, what changed was I got out of my dogmatic ways. I mean, it's easy when you get into the fitness industry, which is a very polarized industry. Same thing with rehab, where you come in, you make these claims, you're like, all right, everybody needs the low bar back squat, conventional deadlift, flat bench press. And then you realize that, hey, this was kind of just trickling over from powerlifting. If I'm working with somebody that's in his 50s, that his goal is to like catch baseball in the backyard with his son and feel good and feel strong into his later years, then we have a lot more tools to work with here to keep people healthy. And if that means, yeah, it was just this realization that, oh boy, I really can't force all of these very specific lifting variations on everybody.
Well, that's great. So and that's a good thing about being open mind, right? Because if you were like a fixed mindset, you will still be, defending the same point of 5 years ago. But as someone with growth mindset that you are expanding your knowledge and passing on.
Yeah, and that's what I say. I say if I'm still teaching this in 10 years, which I hope I am, I would expect the course to be different than it is right now, because we're always looking at what's the latest evidence going on, where are the trends in rehab and performance, and like we're always consistently tweaking this course. So what I'm going to teach in Dallas in December is different than when I taught in April, because a couple new papers came out this year that we're teasing into this course. So the course is always growing, and we want it to be this, okay, this is like a state of the industry, evidence-based right now. And that's what we're looking to do.
Many certifications, they actually have version number, like certification V1, V2. As you progress the material, do you also plan to update the certification?
I think if we get to the point where if we have to make any kind of radical changes based on the current evidence, we will do that. But from now, it's just been a little tweak to a slide here and there. Yeah. So not enough for me. So the course is 99% the same as it was in April, right?
So just little updates.
Exactly. Like if a new paper comes out, then we might add a slide or tweak some verbiage. So in the future, if we do have to revamp it based on, hey, maybe things are changing, then yes, I would consider that. But right now it's just, hey, maybe one of my additional instructors say, hey, did you know this new paper came out? This would be a great thing to tease in here. Then yeah, we're gonna add it in. We're gonna throw an extra reference on the bibliography, and we're gonna update the manual.
Yeah. All right, Dr. Mike, this was a very, very good conversation. It makes me want to take the certification because I love certifications, And it's so much knowledge that you gain, even if you, as I said, even if you are not going to treat patients with pain, because I think it helps to be more aware. It brings you more mindful to different scenarios. So I think it's beneficial for everyone.
Yeah, I would agree. Even as mentioned, like all of the principles that we teach can apply to the population that is not in pain as well. But it will for sure arm you if a client does start to have pain. Then you'll know, okay, this is what I can do as a personal trainer. This is what's in my scope as a personal trainer, and here is when I should be thinking of referring out to a physical therapist. So we really talk about that interdisciplinary approach in a perfect world, how we believe personal trainers and physical therapists can really blend. Each profession can bring something to the table, right? And I think that if we keep that growth mindset and realize that if there's all of this fighting, the only person that really loses is the client. So let's get on the same page here. Let's realize that, hey, each of us has something really beneficial to bring to this client, and we don't need to step on each other's toes. We can work harmoniously and really improve client outcomes.
Outstanding. Thanks a lot, Dr. Mike. I appreciate your time.
Thanks for having me on, Yuri.
All right. Thanks, everyone, for tuning in on Unleash Podcast, and see you again next time.